On this series on understanding and correcting your blood markers, we're focusing on blood sugar. There are a few ways that we can assess our blood sugar. The first is measuring glucose at any point in time. So this can be done in a fasted or fed state, and this will give us a snapshot in time in terms of what's happening with our glucose levels. The second way, and typically the most common way done, is a test called hemoglobin A1C. So basically what this test represents is your 3-month average glycosylated sugar. So essentially the red blood cell lives for an average of 3 months, and it's the amount of sugar that attaches to that red blood cell over its lifespan. And this actually gives us an average of what our sugar levels are for 3 months. This test is most commonly used to assess for diabetes, prediabetes. It's a really important metric to focus on. One thing that's very interesting is typically we're not classified as having prediabetes until we get to a level of 6.0. In my practice, I tend to treat anytime I see a patient over 5.4. I don't like to wait until they get to that range. I like to treat it early. I do find that glucose and blood glucose, it really connects to all chronic conditions, so we want to make sure that those levels are in check. Most of the time, your medical doctor will not let you know about an elevated A1C until you get close to the 5.9 or 6 range. The patient that I have today, their A1C levels are at 5.9. So they are not yet at that 6.0, which is the pre-diabetic range. We do want to take some pretty aggressive measures to bring that level down to prevent progression to diabetes and also support their health overall. The third way to look at glucose, and this test is not commonly done, is something called fasting insulin. So our pancreas, which actually sits at the back of our body, it will release insulin in response to elevated blood sugar. And it actually takes the sugar from our blood and it will store it depending on where there is space. So it will store it in the liver if there's space. If the liver gets full, it will store it in the muscle. And if the muscle is full, it will store it into the fat. So elevated insulin, especially in the context of elevated A1C, is a lot more difficult to treat and a lot more complicated. So for patients that have an elevated A1C, but a normal insulin, that is much better than having both elevated A1C and insulin. Typically, we want to see a fasting insulin under 60, and that would tell me that the patient is insulin sensitive, which again is a very important marker for overall health. Glucose and A1C can be decreased several ways, but the most effective is actually to increase your muscle mass. Muscle is termed as what we call an insulin sink, meaning the more muscle mass you have, the more ability your body has to deposit glucose into the cell. There are a few ways we can think about in terms of bringing muscle mass up. The first is consistent and effective strength training. I typically recommend strength training 4 times per week, and strength training in a way that is actually challenging to the muscle, so you are seeing an increase in muscle mass. I do recommend not just tracking your weight, but also measuring your lean mass and your muscle mass. There are a few ways that we can do this. The way that I prefer is through body fat calipers, because it's a very specific way to assess for your fat mass and your lean mass. And it also tells me hormonally why you tend to store fat in certain areas. The other way that patients prefer is by using a DEXA scan, which does give me a whole representation of what's happening in terms of muscle mass. In addition to strength training, I do recommend consuming 1 gram of protein per pound of ideal body weight. So for example, if your ideal weight is 150 pounds, you would try to consume approximately 150 grams per day of protein. Trying to prioritize protein coming from animal sources, so things like beef, chicken, eggs, fish, is going to give you a lot better effect at building muscle mass than deriving it from plant sources. The other ways that we can look at dropping your blood glucose levels would be to look at the amount of carbohydrate that you're consuming. So I typically recommend consuming 50 grams per day of net carbohydrate. When we look at carbohydrate, there's 3 different types. There's our starch, there's sugar, and fiber. Net carb is looking at the total carbohydrate subtracting the fiber. So it's really only looking at the starch and the sugar, or the part of the carbohydrate that is actually affecting the blood sugar. Most vegetables are going to have fiber. So when we're looking at 50 grams of net carb, it's approximately 2 pieces of fruit or 2 half cup servings of starch per day. We do also want to think about having a higher amount of fiber in the body, and this can be done through cooked green vegetables. If you don't like those, we can actually also add in supplemental fiber like psyllium husk. Psyllium does work in several patients. I do find some people get some gut irritation with it, so I do recommend starting with about a half tablespoon per day in water, and then you can gradually increase that up to a full tablespoon twice a day. The fiber actually helps to naturally lower the blood glucose because we don't get such an increase in the spike with a meal if we take it with our meal. The other way that we can bring our A1C down is by practicing something called circadian fasting. And essentially what that means is trying to eat in sequence with the sun cycles. Typically with circadian fasting, aiming to have no calories 3 to 4 hours before bed is a really effective strategy for several reasons. The first being that we tend to release growth hormone about an hour into deep sleep. This hormone gets us lean, it gets us strong, and when we eat close to bed, the insulin that we produce from the food will actually negate or drop that growth hormone spike. Secondarily, when we eat close to bed, we do get interruptions in our sleep. And when we have poor sleep, that actually affects our blood glucose the following day in terms of having erratic blood sugar patterns. I think one really interesting study that I looked at was seeing 2 to 3 nights of insufficient sleep, so less than 6 hours, our body did start to behave as though we were a type 2 diabetic in terms of blood glucose regulation. So sleep is actually very important in terms of regulating our glucose, and not consuming calories close to bed further accentuates that. 2 other things that we can add in to drop our A1C. So the first would be to do about a 20-minute walk after your dinner. We have what are called GLUT4 receptors on our muscle, and these are specialized receptors that actually uptake glucose only with exercise. And I have actually seen this a lot on patients with continuous blood glucose monitors, taking their blood glucose after a meal, and then taking their blood glucose after the same meal, but adding in a 20-minute walk. And they saw a radical drop in their post-meal glucose. So it's a really simple way to drop your glucose after a meal by just adding in a simple walk. Lastly, there is a herb called berberine that I have found to also be very effective. Berberine has antimicrobial properties, but it also very effectively lowers blood glucose. There was one study where they compared it to metformin, which is a diabetic drug, and they found that it worked similarly in terms of lowering blood glucose. Typically with berberine, you want to take this 1 capsule with lunch, 1 capsule with dinner, and it can have a favorable response on your blood glucose. For every patient, the levels are a little bit different, but this is just what I've seen with my patients in my practice.